Good morning, everyone. I am so excited to be here. What a great conversation this morning. Listening this morning to Governor Christie and Secretary of Education, former Secretary of Education, Arne Duncan, really was bringing me back. You heard a lot about how children felt in terms of safety at their schools, and I was sort of reminiscing. I was Chief of Safety and Security for Chicago Public Schools up to 1 week ago. And so 14 years ago, 14 years in that job. And I've since moved on. I'm currently a partner at a group called PACT Group. We are seeking to expand safety holistically across large and small systems. Before we get into the panel, just wanted to talk a little bit about the intersection, and some of the conversation overlaps with some of the other panels about the importance of collaboration, of bringing it local, of involving those who are at the center of the issue into the conversation. This can't be something that we are doing in a vacuum. It has to involve everyone. And if we're not doing that, it will not be sustainable. And so one of the things I wanted to share about a couple of examples of Chicago Public Schools, just to sort of set the table. We have a few programs. You might have heard of them in the past through other examples here. One is Choose to Change, which is a mentoring program where we are bringing in our young people who are from the highest risk situations. They are telling us what their needs are. And through the use of cognitive behavioral therapy, we have seen tremendous results. Youth Advocate Program, Brightpoint, and University of Chicago Crime and Ed Labs developed the program, and we've seen through a randomized control trial, 39% reduction in the likelihood that they'll get arrested for a violent crime. We're really grateful for that. Another example is Project Unloaded. You just heard from Dr. Julie Merida, who was formerly CDPH, Chicago Department of Public Health Commissioner. She's now with Joyce, and they are a big funder of Project Unloaded, where we actually bring students to the table to develop campaigns around how do we change the narrative on gun culture. So that is something else. And then we have Youth Guidance, Becoming a Man, another high-touch mentoring program where cognitive behavioral therapy is our secret sauce. So those are just some examples. We're seeing results. And before I turn it over to my esteemed colleagues here, I just want to share there is hope. In Chicago, again, 14 years, we have seen, you heard Arne said it, kids shot and killed every other week. When I arrived in 2011, it was every week. Every week, a student that is enrolled was getting shot and killed. By the time I checked the numbers, I called my team last week, we're down 57%, which is progress. It's not enough.
Great.
Thank you. It's not enough. We have a long way to go, but it means there's hope. And so I share that to say as we enter into this conversation. First question for each of you. If you can please just give a brief overview and your intersection with the work of gun violence.
Well, first, thank you all for having me today. I'm Lieutenant Governor Austin Davis from the Commonwealth of Pennsylvania, and I really got my start in public service because of an act of gun violence which came to my community. I grew up in the city of McKeesport's a small former steel town in western Pennsylvania, and there was a shooting in my neighborhood, and that really shattered the sense of safety and security for my family. And so as a young person, it inspired me to start a violence intervention group with some folks from my high school to take on gun violence in my community. But it's been the singular issue that I've worked on in every position that I've held. When I started my career in county government, I helped set up the first Office of Violence Prevention in the Allegheny County Health Department, right in the city of Pittsburgh, to look at gun violence from a public health perspective. When I was a state representative, I helped seed the first gun violence reduction grant initiative, which is the VIP grant program that grew from a $5 million investment to, I think we proposed $60 million in the governor's budget this year. And now, as the lieutenant governor, one of the first responsibilities that I asked for when I got elected was to chair the Pennsylvania Commission on Crime and Delinquency, which is basically our criminal justice policymaking arm for state government. And we've done a tremendous amount of work in a relatively short time to take on gun violence and make our community safer. And we're starting to see real results. Violent crime is down in Philadelphia and every major city across Pennsylvania. And so we've been saying now's the time to not take our foot off the gas, but to double down on the investments that we've been making, because we've seen they've been working. And we have really seen bipartisan support for these initiatives across Pennsylvania.
Hi, I'm Bob Garrett. I'm the CEO at Hackensack Meridian Health. We're the largest healthcare system in New Jersey. And, you know, as a health system, we have multiple trauma centers. We have 2 children's hospitals. We have a behavioral health hospital as well. So it is important for us not just to treat victims of gun violence, but part of our mission, which is to transform healthcare, we have to focus on prevention. And we have I think some interesting stories, some good success metrics out there. We have a program that I'm going to talk about in a few minutes called Project HEAL, which was the result of federal and state dollars coming together to treat gun violence victims and their families. But prevention is a very, very big part of our mission. It's a big part of the mission of hospitals and health systems really all over the country. So I'm happy to be here to share some of our stories. I'm proud of the work that our team members are doing each day on this very, very important issue. And I totally agree with the Lieutenant Governor. This is the time that we need to double down more than ever before.
Thank you. Anthony?
Good morning, y'all. Anthony Smith, Executive Director with Cities United. We support a network of jurisdictions across the country, helping them develop comprehensive public safety strategies to really not only reduce the number of gun violent incidents, but create better outcomes for those who are most impacted by gun violence. And I just want to say to Nazir, we see you, bro. We love you, and we appreciate you being in this room. So you being here is enough. So we just want to say I appreciate you. I also want to give flowers to Erica Ford, who's sitting here, and Pastor Mike, 2 of the folks who I idolize in this movement and in this work. But I got into this work. You can give them a hand. Yep. I started my career doing outreach to folks when they were calling young people disconnected, young people trying to help them get back on track, get back in school, and went to way too many funerals, right? We were burying too many people. And I think there's a number that keeps, like, I hear it, but I'm also trying to grapple with this ideal around gun violence is now and is the #1 cause of death of our children and teens. And I feel like that's been that way for young black men and boys, right? It's been the #1 killer for young black men and boys for decades. And now this country is finally paying attention. And I just want to make sure we say that, right? Because I think we gloss over the fact of who's been impacted by gun violence for decades. And I appreciate that there's more people at the table, there's more conversation happening. But my work and my job is to make sure that young black men and boys and their families and the communities that they live in have the same resources that everybody else has, have the same dreams that everybody else has, and the same access to safe spaces like this. So I just want to make sure we say that in this room. But excited to be here, excited to be a part of the conversation, and looking forward to seeing how we move things forward.
Great, thank you so much. So we're going to jump into a few questions. I'll focus them on a specific respondent. First one's for you, Lieutenant Governor. Over the last 4 years, I know a lot of people in this room are thinking about this. Over the last 4 years, we've had historic investments from the federal government into this work. We're not so sure how long these are going to last. How, in your role, are you going to make sure that we can continue to leverage or stretch those funds so that you can maintain the momentum that your team has built?
Yeah, so I think one of the things that we started early is a recognition of all the great work that the Biden-Harris team was building, that there may be a day that they would not be there. And so we needed to really focus on building community in Pennsylvania, building an ecosystem for violence prevention organizations to grow and thrive. And so we've been providing technical support to organizations across Pennsylvania to be able to learn from each other. We've been doing a lot of planning grants to give organizations the resources that they need to be forward thinking about how they grow and expand their organization. We've also in a number of ways been incentivizing collaboration between grantees, because we recognize that folks work better when they're working together as opposed to in silos. And so we've been really rewarding folks who take a collaborative approach through our funding mechanisms. I'm really proud of the fact that we stood up the first Office of Gun Violence Prevention in Pennsylvania under my term in office, and it's housed under PCCD, the commission that I lead. So we've really taken a leadership role to say that we're going to continue to build out the community, but we're also going to continue to put our money where our mouth is every year. year the governor and I have been in office, we've put in more resources for violence prevention efforts. One of the things that we're talking a lot about, and I heard briefly in the last panel, is how do we leverage philanthropy dollars to help make government dollars go a little further. And so I think that's kind of the new frontier we're starting to explore in state government. But we've done a lot of work. We got to continue to do that work. But I do think we are in a moment where leadership on many of these issues that we're facing in our communities is quite frankly not going to come from Washington, D.C. It's going to come from state capitals and state legislators and mayor's offices around the country. So I think it's an opportunity for us not to look at what's going on in D.C. for leadership, but to look locally in your communities. And I think one of the other speakers on the other panel was talking about how do we make this work last past individual governors, mayors, and presidents. I think we each have a responsibility to continue to build that foundation, right? To make sure that I build a foundation so when I'm no longer the lieutenant governor or the governor's no longer the governor, there's a solid foundation for that work to continue independent of the politics of the day, and that we've built that ecosystem that really allows these organizations to thrive because we know we're not going to police our way out of this problem. We know it's going to take a holistic approach and a comprehensive approach to take on gun violence, and so we have to be firing on all cylinders.
That's excellent. Thank you so much. Anthony, please, go ahead,
Just pick
Bob.
up on the point of collaboration, I think, with respect to funding. I think it is important. I think we don't give up on the federal-state partnerships. I think we double down on those in a way. We invite those stakeholders to come and see the good work that we're doing. We've done that with this particular Project HEAL, which gets funded both by our Attorney General's office in New Jersey and also by the Department of Justice. And there are individuals, both in Washington and in our state of New Jersey, that are really committed to this program. So, I think what we're going to try to do is, again, doubling down on staying engaged with those stakeholders and showing them how the money is being spent, and hopefully the grants will continue because, again, hopefully these relationships, these partnerships, these collaborations last beyond whichever way the political winds happen to be blowing.
That's really helpful. Did you want to add anything to this, Anthony?
No, I think the only thing to add to what Governor and Bob has said, Lieutenant Governor have said, I don't know if I'm forecasting.
No, it's okay.
Congratulations.
Have said is that I think all budgets should be looked as public safety budgets, right? Yeah. So not just the state, the county, and the city budget. I think our school budgets, right? School budgets need to be looked at as part of public safety. And then the corporations and the healthcare place. I think if we can help folks see how what folks do on the ground is part of the public safety ecosystem, it's easier for us to figure out how to fund it and recalibrate our dollars. I think we should have never fully funded, dependent on either foundations and our federal dollars to support all of that. I think everybody's got to chip in on this to make this thing work. And we've got to right size it to a place where we have the right number of folks who are doing outreach work, the intervention work, the hospital-based work, and all of those things. Because right now people are still working on the shoestring budget. Mm-hmm. We've got folks who are at risk of being laid off, not being able to pay for their kids and their meals and their housing. And I think, we need to step up. So I think the double down is right. But it's ideal around every budget that we look at across our jurisdictions need to have carved out budget or line items for CVI and for gun violence prevention work if we're truly trying to get to the public safety we're looking for.
And I'll just jump in from my perspective. The idea that there's one bucket of money, how are we using it? In school safety at Chicago Public Schools, we reimagine what does safety mean. Yeah. Safety is not just my security officers. Safety is also the social emotional side, the counselors, the social workers, the mentoring I just talked about. And if we can reimagine these buckets in a different way, it means that we can do more when we know the results are there. And so the data shows, my evaluator sitting in the room in the back row, the data shows that when you have programs that work and you keep iterating on them until they do, then that's a good investment.
So just one last thing to add to your point about everything is interconnected. When I look at it from government, what we invest in public education versus what we invest in after-school programs and workforce development programs are all tied to public safety.
Yes.
I firmly believe, we have to create multiple ladders of opportunity for folks to succeed and live the American dream, whatever that looks like for them. And we have to make sure that we know the biggest way a lot of times to take a gun out of somebody's hand is to put a paycheck in it. And we need to figure out a way to make sure that we help that young kid who's 16 years old living in the hood, make sure they have an opportunity. If they want to go to college, we want to make it affordable for them. But if they don't, we want to make sure they have a workforce development program or the ability to start a small business, because we know if they're doing that, then our communities will be safer.
Yeah.
Love that. Thank you. Anthony, this next question's for you. You've been working on this your whole life, and I know you're very devoted to it from the short time we've known each other. As the public debate and policies, like our positions, I love that agree to agree, because I do know from my experiences is that people are not always on the same page. From your perspective, in this world of uncertainty, in terms of power structures and what have you, what key trends do you see at the local level where you're sitting on how we can bring people together? How can we help people feel a little bit more confident that we're doubling down in this world of uncertainty?
Yeah, so that's a good question. And I think, again, there's a lot of people in this room who could probably answer this a whole lot better than I am, because they're doing it on the day-to-day, right? You got Shondell here from Philadelphia. You've got other folks who are in this room who do this every day. But I think that's the thing that makes it a little bit more certain for me, is that the resolve of the people who lead this work is still there. Right, I think about what's going on in Toledo with Malcolm and his team. They are still meeting every month, talking about how they're going to move their work forward. The mayor is still engaged in the work and still funding the work. Think about what's going on in Lexington, Kentucky, right, with the mayor there and their team. So there's people all across this country who are waking up every day still doing this work and understand that there's some uncertainty happening here. But they also see the balance and that we're losing too many lives still in front of them. So you've got to continue to move the work forward. I think, so when we started Cities United, Mayor Nutter, former mayor of Philadelphia, and Dr. Bell, who runs Casey Family Programs, they had a conversation in 2010 around there's way too many young black men and boys dying in our streets and nobody's having a conversation around it. So they created this thing, Cities United, that I now get to run, that's in hundreds of cities across the country. So for me, the hope is that there's tons of people who still care about this work. Yeah. There's tons of people who still wake up about this work. And as you heard Pastor Mike talk about before, there's hundreds of thousands of people who do this work every day when a paycheck wasn't there, right? So there's resolve there. And the uncertainty is that we don't know what the federal government's ever going to do when you talk about black and brown communities. But I do know that folks who live and support and love black and brown communities are going to show up and do the work that they need to do. So for me, that's what I'm certain about. Will we need the resources to do it? Yes. Do we need more dollars to do that? But I also know folks are going to do it anyway. So therefore, we're going to continue to move and make sure that our kids are safe, healthy, and hopeful in the long run.
Great. Thank you so much. Does anyone want to add anything to that?
I think you're 100% right that there are people engaged in this work who are not going away, and they're going to continue to be engaged moving forward. I think we need to make sure we harness that energy. And I think, unfortunately, over time, I think when gun violence was strictly an inner city issue, it was harder to build support around it. But I think when you started to see Sandy Hook in suburban communities deal with the issue of gun violence, you've started to see more and more people come towards the cause. And I often don't question whether we're going to pass common sense gun reform laws in Pennsylvania, whether we're going to have more resources for these things. Because I think we will. I think the unfortunate question is how many people are going to have to die before certain elected officials in office recognize that we need to act. And so I think the intensity is going to continue to be there. And from a federal perspective, we should not make a demand from the Trump administration. The reality is the easiest thing for them to think was that, well, they're not going to fund it. We should stop asking them. We should demand that they invest in our communities and make communities safer. So I don't want anybody leaving here feeling like we should give up on that. We should certainly continue the pressure campaign. Under the last Trump presidency, we saw gun violence skyrocket in our communities, and we should not allow that to happen again, and we should not be silent on that. if it does.
Just to respond to that, I think, yes, we need to continue to demand, and I think that's what there's a group of us with the Black and Brown Collective consortium here in this room. Even when the Biden administration, who was friendly and supported this work, they came with just $900 million to solve this issue. We pushed and called for them to put $5 billion, right? And they put it in there. It didn't make it through the budget, but the thing to push, not only when there seems to be opposition, even when there's friendly folks we've got to continue to push and demand. And I think the thing that Pastor Mike said that resonated the most was around building that power to continue to move that, right? Because again, this is a long game. And I think that's how we got to look at it and continue to push that way. So I agree 100%. We got to demand and push forward on all fronts.
I think you guys said it really well. The only thing I'll add to the conversation is, and we talked about it at the CEO meeting this morning, stay true to our values. This is an important, and Governor Christie said that this morning a little bit too, right? We need to stay true to our values, but find common ground to engage stakeholders at every level, because there are things that we agree on. So start the conversation, and then I agree, let's then get in with our demands, but let's start the conversation on things that we can agree upon.
Great, thank you for that, Bob. The next question's for you.
Okay.
And this could be like, this is the whole day. This next question's like in this the whole day we're talking about how healthcare intersects with this work. And I'm so grateful to Northwell, Michael Dowling, for pulling all of this together for so many years. This is the future, is the intersection of all of this work. But you being our healthcare representative right now on this panel, can you please, just for everyone in the context of local jurisdiction, local communities, speak to this intersection and how you feel this is evolving, how we doing, and where we going?
Yeah, and I do want to give a shout out to Michael Dowling and the Northwell team for really pulling this together and taking a leadership role. It's really made a big difference. So the way I look at it, I think about it in two buckets from a healthcare perspective. One is in the treatment bucket and one is in the prevention bucket. So there are programs like this Project HEAL that I mentioned that have helped already since 2022 1,000 individuals and families who are victims of gun violence. And that's done through a collaborative local effort with social service agencies, with places of worship, with schools. There's financial assistance, there's transportation provided. And we have some great stories of success, and that's why we've been able to continue to engage local stakeholders and federal stakeholders. On the prevention side, and think about it from a healthcare perspective, hospitals and health systems, a big part of our mission is to keep our communities healthy. Mm-hmm. And when I think about it from a holistic perspective, 80% of healthcare outcomes are determined by non-medical issues, what we commonly call the social determinants of health. It could be food insecurities or insecure housing or lack of transportation to get to the physician's offices. We actually screen our communities, particularly communities that may be more prone to gun violence. We have screened over 2 million people. We've made over 4 million referrals for people to get help. And one of the things that jumps to the top, aside from the issues I mentioned, is also lack of access to mental health facilities, which of course is a major factor in gun violence. So what have we done? We've expanded access by creating behavioral health centers of excellence at several of our hospitals and some of our underserved communities. We've expanded addiction treatment. We've actually put what is the first in the state of New Jersey, a behavioral health urgent care center, again located in a community that's more prone for gun violence, and it gives people easier access to when they are in mental health crisis. These are the kinds of, I think, the kinds of things that I think about from a preventative perspective. We need to really keep focus on some of these social issues that potentially are causing more gun violence. So I don't think about the traditional hospital mission might have been to take care of sick patients, but we also really feel what we're doing on gun violence prevention, on the social determinants of health, are a big part of our mission.
Absolutely. And I think, out of all of this, we have one question left, which we'll call the lightning rod. Lightning round, sorry, not the lightning round.
Could be a rod.
One of the things I think out of all of these conversations is the importance of sharing this information. A lot of the learnings that I've heard this morning from this panel and all the other panels, we should be sharing so that we can be replicating and using in our own cities. lightning round, folks. One question for each of you, if you could please briefly answer so we can get back on track. Last question. Please share with us the one or two top opportunities that you see as in your local areas that we should be looking out for in your cities.
Yeah, so I think for us, it's how do we engage the philanthropy community and leverage it at scale in the Commonwealth of Pennsylvania to really make the dollars that we're investing go further. We know across Pennsylvania, we all are aligned in terms of values, but we need to get aligned in terms of resources. So we're working to do that. And then the second thing would be our continued investment in upstream models to keep people out of crisis, whether that's, we are proposing $20 million. Last year, we started the first investment in after-school programs in state dollars. In our history, we're proposing doubling that to $20 million this year. And so we're going to continue to do that, investments in workforce development programs, more money for education. So making sure that we're creating those ladders of opportunity for success for people in Pennsylvania.
Excellent. Bob?
I would say, as I look at the next 12 months, probably the biggest opportunity for us is to continue to expand access to behavioral health and focusing in on preventing gun violence. So right now we're building additional beds at our psychiatric hospital for children and adolescents. It's really very sad. I think one of the other speakers said before about childhood suicides and childhood violence that's been going on, and we think that we need more of these types of beds, we need more of these types of services. So in the next 12 months, I'm really looking forward to having those services, having those programs, having those beds come online to help particularly our youngest of the population get help.
Thank you.
Yeah,
Anthony.
just real quick, and this would be a couple of more shout outs too, but it's not local, but they're supporting local work. I think one, I'm going to talk to Dr. Chico Tillman, who leads the CVI Leadership Academy, who's training a lot of folks who are doing this work on the front line and taking cohorts through 6 months of training. That's securing and building the field and making sure the field is right. And then Arissa Napper Williams in the back, also who runs Not Another Child. We've got to always make sure that we put survivors' voices in the room and that we give them the space. And she's building national networks with that as well, not only in her home city, but bringing other folks together. And I think those are the things when we think about how we continue to weave this all together so that we're tight, is having folks like them who are leading the charge and bringing folks together and making that happen, not just in their cities, but across the country. So
excellent.
Yeah.
And so with that, I'll just close it out by, again, thanking Northwell for pulling this all together and asking if we could do this every week. Wouldn't it be great? Learned so much. Thank you guys so much for your time. Thank you for giving us your attention.